Welcome everyone. This is our third video of Chapter 1, also our third video of the semester. We are continuing through the orientation to the human body. We will be wrapping up the chapter in this lecture. So, as we mentioned in the previous video, from now on, we will be starting with those not really attendance questions like I do in my in-person classes, and you should be pausing the video when we do these so that you can check your understanding and make sure that you know the answer without waiting for me to give it to you. So, the not really attendance question for today. In the case of someone getting cold and shivering, what is the effector? And the other question, your friend Harold slips and falls on the ice. You know that it's better to land on your padded backside, but he doesn't. So he sticks out his arms to help and breaks his thumb. With your newfound A&P training, you can be helpful, and you decide to tell him the name of the region of his break. What is the name of that region? So go ahead, pause the video, try to answer these questions, and then resume the video and see if you were correct. Okay, hopefully you paused your video and answered those. Let's see if you got them. In the case of someone getting cold and shivering, what is the effector? Well, remember the effector is the part of the body that is responding to that change in the stimulus, and in a negative feedback loop, it is trying to negate or reduce that initial change. So in this case, when someone gets cold, the effector is going to do something to warm us back up by shivering. What is it that's actually causing the shivering? Skeletal muscle. Remember from last time, skeletal muscle is the type of muscle that we voluntarily move. It can also be done involuntarily, as in the case of shivering, but that's what's happening. When we shiver, skeletal muscle is contracting and relaxing very, very quickly, and that causes heat to be released, and that warms us up. Next, Harold falls and breaks his thumb. You know the name of that region, so what is the proper name for the thumb region when we're talking anatomy? See if you can think of that. Well, the thumb is one of the fingers. And the fingers, remember, are your carpals. But the thumb is not a carpal region. The thumb actually has its own name, and that is the pollex region. Similar, if we looked at the toes are the tarsals, but the great toe or the big toe is called the hallux region. So let's go ahead and start with today's lecture. And we're going to begin talking about body cavities. Now, the body has open spaces within it, and that's where we find the organs. And even though there are several cavities, there are two major sets of internal body cavities, and they are completely closed to the environment. So in these body cavities, there is no exposure to the outside environment. They provide protection, but based on which of the two we're talking about, they provide different degrees of protection to those organs. And something else we will see in a moment, each of these two major internal body cavities are further divided into smaller cavities. So first, let's look at the two major body cavities. They are the dorsal body cavity and the ventral body cavity. And we saw these terms used in the previous lecture when we were talking about directional terminology, and we know that dorsal is the back in a human, and ventral is the front in a human. And one way to remember that is the vent, V-E-N-T, that is the scientific term for the opening where urine is released from, vent. So the side where the opening where urine is released from, so the side where the vent is found, is the ventral side. And in humans, that's the front. So we're now going to look at the dorsal and ventral body cavities. First, let's talk about the dorsal body cavity, the cavity in back. And this is where we find our central nervous system, our brain, and our spine. So the dorsal body cavity, like I said, they are all broken down into smaller cavities. The dorsal is broken into the cranial cavity and the vertebral cavity. So if I asked you, what are the divisions of the dorsal body cavity? You would say cranial and ventral. I'm sorry, cranial and vertebral. The cranial cavity is where we find the brain. So it's the inside of the top of the skull. And the vertebral cavity is where we find our spinal cord. It's a tunnel that goes down through our vertebrae. So what sometimes you'll hear called the backbone. It's not really a single bone, it's lots of bones in your back. And there is a hole in each one of them that the spinal cord passes through. So the dorsal body cavity is divided into the cranial cavity, where we find the brain, and the vertebral cavity, where we find the spinal cord. Next is the ventral body cavity. And the ventral body cavity is the front, and it is much more extensive than the dorsal body cavity. The ventral body cavity is where we find all of our major internal organs that we typically think about when we think about internal organs. We call these the viscera. Viscera is just another term for all of the internal organs. And the ventral body cavity is further broken down into two cavities, the thoracic cavity and the abdominopelvic cavity. The thoracic cavity is the chest. The abdominopelvic cavity is down here, what we would sometimes call our belly or our gut. So these two cavities are separated by a large muscle that we see right here called the diaphragm. The diaphragm, that's what moves to help us breathe or cause us to breathe. And the thoracic cavity is above or superior to the diaphragm. The abdominopelvic cavity is below or inferior to our diaphragm. But not only is the ventral body cavity broken into thoracic and abdominopelvic, both the thoracic and the abdominopelvic cavity are further divided. So they also have smaller cavities within them. Let's look at the thoracic cavity, the chest. So inside the chest, within the rib cage, that's our thoracic cavity. And it has 3 cavities within it. 2 pleural cavities. Each pleural cavity surrounds one of our lungs. So right here is the right lung. Over here is the left lung. Each of these lungs sits within a cavity called either the left or right pleural cavity. In between the 2 pleural cavities, starting at the lower part of the throat and going all the way down to the diaphragm, is something called the mediastinum. The mediastinum, or sometimes called the medial mediastinum. And that contains some of the vessels and part of your respiratory tree, the lower part of the throat, where we find the trachea, the breathing tube, or the larynx, sometimes called the voice box or the Adam's apple. That's in the mediastinum. But then also the mediastinum has a smaller cavity within it called the pericardial cavity. And the pericardial cavity is where we find the heart. So let's kind of back it up. The heart sits within the pericardial cavity. The pericardial cavity sits within the mediastinum. The mediastinum sits within the thoracic cavity, which also happens to have two pleural cavities. And the thoracic cavity is the superior portion of the ventral cavity. It's kind of like those nesting dolls where you open one doll and there's another doll inside, and then you open that and there's another doll inside. That's what's going on with the ventral body cavity. The ventral body cavity, one last time, has the thoracic and the abdominopelvic. If we look at the thoracic, it has two pleural cavities and a mediastinum, and within the mediastinum is the pericardial cavity. There's a lot going on in the upper part of that ventral body cavity. But if we look below the diaphragm, in the inferior part of the ventral body cavity, we find the abdominopelvic cavity. And it is also further divided into smaller cavities. First, we have the abdominal cavity, and that is the major portion, takes up the vast majority of what we typically call our gut or our belly. The abdominal cavity contains our stomach, our liver, the gallbladder, the large and small intestines, most of the large intestines, the spleen. So really almost everything you see here is within the abdominal cavity portion of the abdominopelvic cavity. Just so everyone knows, I'll run through this real quick. This is from our cadaver that we have at the Newtown campus. This is the liver. Here is the gallbladder, which is very enlarged. This person also had gallstones, so when you squeeze this, it feels like it's full of gravel. This is the stomach. Here is a portion of the pancreas. Most of what we see here are small intestines. And then there is just a little bit that we can see of the large intestine through here, but it's kind of tucked under everything. Well, in the most inferior part of the abdominopelvic cavity is the pelvic cavity. And the pelvic cavity is just kind of a funnel-shaped region that's not really in this frame right here, but it extends down further down towards the area behind the genitals. And inside the pelvic cavity, we find the urinary bladder, the reproductive organs, and the rectum. So the rectum is a part of the large intestines. That's why I said up here most of the large intestines, because part of the large intestines do extend down into the pelvic cavity. Now, when we were looking at, let me back up here. When we were looking at the thoracic cavity, there's a lot of separation. We've cleared this out in this image. So You can't really see a lot of the membranes. You can see a little bit of the membrane here, but there was a lot of separation between each pleural cavity and the pericardial cavity mediastinum area. There was quite a bit of separation. And you can see, even without the membrane in place, the lung is pretty well separated from the heart here, which is pretty well separated from this other lung. But when we look at the abdominal pelvic cavity, everything here just kind of runs together and moves from one area to another pretty freely. Now, the abdominal cavity and the pelvic cavity, they are separate, but there's not a lot of abdomen-pelvic separation. Like I said, down here, it's just kind of a funnel-shaped area, and that's really the only separation that we have. There's not a membrane that separates the abdomen from the pelvic region there. Okay, so now I've mentioned some membranes. Well, those membranes that I'm talking about are called serous membranes, or sometimes you'll hear them just called serosa. They mean the same thing. Serous membrane and serosa, they're the same thing. And the serous membrane, the serosa, is a membrane that surrounds all of the organs in our ventral body cavity. And there are different serosa around different parts of those cavities. The serous membrane is a thin, double-layered membrane. And double-layered is kind of tricky. It really is a single-layered membrane, but it folds back on itself so that it produces two layers that are really just extensions of each other. Take a piece of paper and gently fold it over. It's really one piece of paper, but it's two layers. So the serous membranes, it's one membrane that is folded over to make two layers. And this two-layered membrane is found surrounding all of the organs in our ventral body cavity. The parietal serosa is what we call the outer layer, the layer closest to our body wall. And the visceral serosa is the inner layer. This layer rests directly on the surface of the organ that is being surrounded. And remember, we said that viscera is another name for those organs. That's how you can remember what's what. The visceral serosa is the layer of the serous membrane that rests directly on the surface of the organ that it's surrounding. Go back up here. Pariet is a root word that means wall or side. So this is against the side or against the wall of our body cavity. It's the same membrane, just folded back on itself to make two layers, the outer parietal layer and the inner visceral layer. And in between those two layers, it's not just open space. It's filled with a lubricating and protecting liquid called serous fluid. So we can kind of imagine this as an outer parietal layer, a layer of serous fluid, and an inner visceral layer. Now that fluid, that serous fluid, it's constantly being renewed, refreshed, and it's being produced by both layers of the serous membrane. The parietal layer secretes it inward, the visceral layer secretes it outward, so there's constantly serous fluid being produced in that cavity. Now, there is a lot going on in those cavities. So we could say the serous membrane around the lung. or the serous membrane around the intestines. But we like to give more specific names. So we saw that it's not just a membrane. Which one are we talking about? The parietal or the visceral? And if it's going to be covering all these different organs, we can be more specific with where are we talking about. So the serous membranes are named for the specific cavity and organs with which they are associated or which they surround. Each one of them has both a parietal and a visceral layer. So if we look at the cavity where the heart is, remember that was the pericardial cavity, and we just said that it is surrounded by a two-layer membrane, a serous membrane, we can be specific with the name of it. That membrane is called the pericardium, and the pericardium has two layers, an outer parietal pericardium and an inner visceral pericardium. The visceral layer sits on the surface of the heart. Around each lung, we call that serous membrane pleura. So there is a parietal pleura and a visceral pleura. The visceral pleura sits on the surface of the lungs. And around all of the organs in the abdominopelvic cavity, there is a very, very large serous membrane called the peritoneum. There is a parietal peritoneum and a visceral peritoneum. And the visceral peritoneum sits on the surface of all of the organs in our peritoneal cavity. The peritoneal cavity is the abdominopelvic cavity. Now, we also said that there was fluid there, and the fluid is named similarly. Around the heart, between the layers of the pericardium, there is pericardial fluid. Around the lungs, in between the layers of the pleura, there is pleural fluid. In the abdominopelvic cavity, between the layers of the peritoneum, there's peritoneal fluid. And that fluid acts to lubricate, to keep those layers from rubbing together. So here we get kind of a illustration of what that looks like around the heart. And then up here, they always give this example of a hand stuck down in a balloon. I don't really care for that, but it does kind of illustrate how this two-layered membrane works. It's all a balloon, but if you were to press your hand down into the balloon and somehow it folds in without popping, well, the balloon would be stuck around your hand. That would represent the visceral layer on the surface of your hand, and then a parietal layer is this outside wall of the balloon. The air inside would be that fluid, that serous fluid. Now, down here, they kind of give us an idea of what it would look like with the heart. The outer layer would be the parietal pericardium. It folds in on itself, lays directly on the surface of the heart. That's the visceral pericardium. And there is pericardial fluid within. And that pericardial fluid is acting as a lubricant to keep those layers from rubbing against each other every time the heart beats. Here is what that pericardial sac or the pericardium looks like in a fresh heart. So here, this is the visceral layer. We can't see the parietal layer. On the other side of this, if we were to tear this open, there would be some fluid inside. And then when we opened the chest of our cadaver, you can see in this view, there is kind of a hidden heart. This was before we cut the pericardium. So this is the pericardium right here. If we were to cut this, which we did, and which you could see in that other image earlier, well, that's where the heart would be within. When I was talking about that membrane earlier in the previous slide, a few slides back, that was the remnants of this pericardium when we cut it and folded it back so that we could see the heart. Well, we keep saying that that fluid is a lubricant. We're constantly having motions, either when our body moves and it causes our organs to kind of shift, or every time we inhale, exhale, our lungs get bigger and smaller, so it would cause the visceral and parietal pleura to rub against each other. Every time our heart beats, the parietal and visceral pericardium would rub against each other. Every time our stomach empties and our intestines move food through, it would cause the parietal and visceral peritoneum to rub against each other. But that serous fluid acts as a lubricant to keep that from happening. Sometimes there is insufficient serous fluid, and we do get rubbing together. And one of the common things that we see is something called pleurisy. Pleurisy is when there is insufficient pleural fluid. Remember, pleural fluid is the fluid in between the visceral and parietal pleura around the lungs. Every time you breathe, it causes extreme pain as those layers rub against each other. And it's a crushing sensation in the chest. It feels like you're having a heart attack. And a lot of the time when someone goes to the emergency room thinking they're having a heart attack, it turns out that it's actually pleurisy. Similarly, peritonitis, when you don't have enough peritoneal fluid in the abdomen, well, that causes severe cramping. And it is almost enough to kind of, well, I suppose it has been the cause of a lot of emergency room visits. It is enough to double you over in pain. It is pretty crushing. And that is, again, because of insufficient peritoneal fluid. Around the heart, it would be very similar to a heart attack, kind of like pleurisy. So here is our first thinking cap question. We will have these all throughout the semester in every chapter, and we can kind of think of them as little pop quizzes. They are not for any points, but they do make excellent bonus questions on exams. So treat these like our not really attendance questions. Try to answer them on your own before listening to the correct answer. See if you really understand the concept. And these, they're going to be a little bit more critical thinking, and they will sometimes be pretty challenging. They're going to be asking you to apply the things that we've learned so far. So, our first thinking cap question: why is the abdominal cavity at greater risk for injury than the thoracic cavity? And that's true. There are a lot more emergency room visits for people that have some sort of damage in their abdominal cavity than there is for someone who has some sort of injury to the thoracic cavity. Why would that be? And if you need a hint, feel your chest and then feel your gut. Okay, so pause the video for a moment and try to answer this. Okay, hopefully you did that. Let's see if we can figure this out. Why is the abdominal cavity at greater risk for injury than the thoracic cavity? Feel your chest, feel your gut. Well, your gut is a lot softer. Your chest is a lot harder because just underneath the skin and fat of your chest, you have a rib cage. And the rib cage is there to protect some really vital organs, our heart and our lungs. Now, there are vital organs down in our abdomen, but not nearly as vital as our heart and our lungs. So the reason we have more injury is because there's not as much protection there. The abdomen doesn't have as much protection. It's got skin and a thick layer of fat, but no bones. Okay. Changing gears now. We're going to talk about ways that we can divide the abdominopelvic region into smaller regions that we can discuss either when doing imaging like x-rays or MRIs, or if a patient comes in and they're talking about pain. We don't just say in the region next to his belly button, but a little up and to one side. No, we're going to divide these areas into smaller regions. And one way that we can do that is using the quadrant system. There are 4 abdominopelvic quadrants, and we can do this by making a plus sign or a cross with the intersection of the lines at the navel, at the belly button. And here it becomes very important to remember when we talk about the patient, we have to use the patient's left and right, not our own left and right. So we can see looking at this, they're switched from us. So the patient's right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. And so if someone comes in and they have a really severe pain and you want to get an x-ray or an MRI or whatever, you can say focus on the right upper quadrant. What can we find there? Something like that. But there's still a lot going on in those quadrants. So we could divide it even further using abdominopelvic regions. And the abdominopelvic regions, we can draw kind of a tic-tac-toe board with the navel in the middle square. And here, again, patient's right, patient's left. Going across the top, we have right and left hypochondriac region and epigastric region. Across the middle, right and left lumbar region and umbilical region. And across the bottom, right and left iliac, or sometimes inguinal. They mean the same area, iliac or inguinal. And the hypogastric, or pubic region. So these words are not as straightforward as the quadrants, right upper, left lower. No, these words are a little bit different. So let's find some easy ways to remember this. Well, let's think about what the words mean. And by now you might have noticed I am a real big fan of root words. And if you understand root words, you can figure out what words mean, even if you've never seen them before. So let's start up here with the hypochondriac region. Hypo, well, it means beneath, below, under. If you've ever had a shot, you've gotten poked with a hypodermic needle, hypo, below derm, the skin. They're giving you a shot below your skin. Well, hypochondriac, sometimes we'll hear that word when we're talking about someone who thinks they're sick all the time, but that's not what we mean here. Hypo is below, But what's it below or behind or about beneath or under? Well, chondra, Chondr, means cartilage. And if you look here, this region of the ribs is cartilage. It's not bone. The bone actually ends kind of over on the side here. You can see these little lines. And this area right here, this is rib cartilage, or it's also called costal cartilage. So this means the area below the cartilage, because it's the area below the rib cartilage. Epigastric. Epi means above or on top of or on the surface. Gaster means stomach. So epigastric means above the stomach. And over here you can see the stomach, most of it is in this region right here. So we are right above the stomach. Now again, we have another hypochondriac, same on both sides. Down here across the middle row, we have right and left lumbar. Lumbar means lower back. So this is right where your lower back would be. And then in the middle, umbilical, pertaining to the navel. The umbilical region, the umbilical cord was attached there. And then going across the bottom, right and left iliac. Well, iliac is another name for the hip area. And inguinal is a word that I always kind of refer to this as the leg pit, kind of like the armpit, but where your leg meets the rest of your body. That little crease there is called the inguinal region. There's a lot of people that get hernias there. So the right iliac region or the right inguinal region, same thing on the left side. Then we have the hypogastric or pubic region. Well, hypo, we've already learned, it means below. Gaster, we've already learned, it means stomach. So down here, it's all below the stomach. And pubic, well, pertaining to the genitals. So it's where the genitals are found. And that's the 9 abdominopelvic regions. So we've talked about the ventral and the dorsal body cavities and the things or the smaller cavities found within each of them. We've talked about the organs and the membranes found within each of them and how they're separated off from the environment. But there are other body cavities. There's some small body cavities all around our body. Some of them are exposed to the environment, some of them are not. So let's look at some of the small body cavities that are exposed to the environment. The oral and the digestive cavities, so inside the mouth, inside the esophagus or the stomach or the intestines or the anus. So all of that is exposed because if you open your mouth wide enough, someone could go down your throat with a tube and get to all of those regions because they are exposed. Next, the nasal cavity. Inside the nose, where we find our sinuses. The orbital cavities. The depressions in our skull where our eyeballs sit. The middle ear cavities. So if you stick something within your ear deep enough, it goes into the middle ear. And then there are some areas that are not exposed to the environment. And these are the synovial cavities. These are the open spaces within our joints. And if you ever pop your knuckles or your ankle or your toes or anything like that, the noise that you hear is some stuff moving around inside those synovial cavities. And here is kind of a mini thinking cap question. Is the interior of the digestive tract, so inside your stomach, inside your intestines, is that internal or external to the body? Well, it seems internal because you can't, one, you can't see it, and two, you have to go through the layers of skin and fat and everything in your gut to get to the inside of your stomach. Or do you? What did I just say a moment ago about the digestive cavity? If you lean back and open your head or open your mouth wide enough, you could go down with a tube to get to the inside of your stomach, the inside of your esophagus, the inside of your intestines. All of that is exposed to the environment. So it is external to the body. We are an open tube from mouth to anus. Similarly with the lungs, we are an open cavity from our mouth and nose down into the inside of our lungs. Those are all external to the body. All right, there is a little bit more self-study, the systems of the body. I would like for you to know each system and a couple of example organs for each system and the major functions of each system. You don't have to know specific details yet because we definitely have not gotten to them yet. We will get to some of them late this semester, and we will cover the rest of them next semester in Bio 139. So for right now, just know what systems there are, some examples of organs, and the major functions of them. All right, so that wraps up our first chapter. We are done with chapter 1, the human body and orientation. Next up, we will start chapter 2, chemistry. That's going to be a little bit deeper. We're going to have several lectures in chapter 2, and once we wrap up chapter 2, that will bring us to our first lecture exam. Okay, I hope you all got a lot out of these lectures. Make sure you are asking questions. Send me an email, send me a text, get in touch with any questions you have, and I will talk to you in our next lecture.